So, welcome to the second lecture in week 2. Hopefully, after the activity, you've learned a little bit about what motivates you to learn. In this segment, we're going to look at understanding differences in learners and why learners are essentially different, and we can't treat them all as the same. By the end of this session, you should be able to discuss what is meant by cognitive, affective, and psychomotor learning, and we did touch on that briefly before. Discuss the role of perception in learning. Describe teaching and learning considerations with children, adults, and older adults. Outline the role of learning styles in teaching and learning. So, coming back to the elements of what we learn. There are essentially 3 elements to what we learn. There's cognitive learning, which is the acquisition of facts and information, and a lot of it's just memory learning. There's psychomotor, which is hands-on skills, and are actually quite complex because not only does the person need to be able to do, they actually need to be able to understand what they're doing. And affective learning, the learning of values, attitudes, beliefs, and feelings. So we need to keep that in the back of our mind. It's important though when we're looking at people is that we don't all see things the same way. How we view things influences the way in which we learn, and some things may be important to one individual but not important to another. You may well have seen this graphic before. Immediately some people will see a vase or a candlestick. Others will see 2 faces. Pause the video until you can actually see both of those. The second one is another one that's commonly used, and it looks immediately to some people like a young woman. Immediately others see an older woman. The younger woman has a choker around her neck and is facing away from is facing away. The older woman is facing downwards with her chin hunched down in her shawl. Again, take some time to actually see the differences. Why is it important to see differences? If we don't understand that we don't all see things the same way, then learning and teaching can be impeded. Finally, here's another one. So some people naturally see a glass half full scenario where some will automatically see the glass is half empty. So we're not dealing with similarities here, we're dealing with different peoples. So that's a start. Okay, the other thing we need to think about, and we did touch on very, very briefly before, is the developmental stages of the learner. It is important to understand that learners develop at different stages, and at different stages they can only do certain things. Some people, we've got time frames here, but some people actually don't move on from certain stages and get stuck at a particular developmental stage. So these are very generic and generalised, and there is some room for variability. So we know some older people who might behave in very adolescent ways, for example, because they haven't met all of those developmental stages. But we'll spend some time talking about this. The term for children as learners is known as pedagogy, and traditionally when we used the term pedagogy it meant child learners or the learning of children. We tend to use that very broadly now to mean learning and teaching broadly, so you'll see it used in different contexts. Just be aware of the term, you don't necessarily need to be able to utilise it. So we're going to take a look at children. So in early childhood, children are quite egocentric. They're concrete thinkers, they have a limited sense of time, they may be fearful, they'll have separation anxiety from their parent or carer. They can't generalise, but they have an active imagination. In middle to late childhood, they start to get a sense of cause and effect. So if I do this, this might happen. So younger children can't do that. They desire concrete information, but there is the development of the ability to reason over this stage. They begin to understand the consequences of actions, but are generally oriented just to the immediate situation. So they can't see the future and how their illness now might impact on their future. Why are we talking about this? Because often nurses work in paediatric units where they have to teach children, and so you need to be able to adjust the teaching that you need to do to the learning that you have. Not just in paediatric units where you come across children, but also in the emergency departments, in operating rooms and other areas. So it is important to understand a little bit about developmental stages of children. Generally, when we're teaching children, it will depend on the age of the child as to how we go about it. Generally, we keep teaching sessions short because there's limited span of concentration. We need to ensure a safe environment, so that means having the carer there or the parent may be useful. Simple explanations. Obviously, terminology and language needs to be appropriate to the age of the child. Where possible, we try to incorporate physical and visual stimuli, and one of the ways we do that is through play, so actually getting them to play, especially if we're trying to teach psychomotor skills, and through activities such as drawing, because young children are quite visual. We need to give praise, encouragement and reinforcement, and to involve families in the teaching and learning episode. When we're talking about adult learners, the terminology andragogy is what we talk about. And again, this is quite general because there's different variations of adults, and while first year university students are considered adult learners, they may well have come from a school system that has not encouraged them to be an adult learner, so that not all of these characteristics may be particularly appropriate. So we're talking very generally, but you still need to know your learner very well. Adults tend to learn best when the learning's relevant to their current circumstances. One example is university students doing a unit of study. Their learning is very centred on the assessment requirements. We know that. That's the way it works. When you get your unit guide for the semester, the first thing most people do is go to the assessment. What do they want me to do? And learning will be quite structured around that. Learning is voluntary and self-initiated. It's person-centred and it involves problem solving. The teacher is a facilitator rather than a teacher per se, so that you facilitate the learning to happen, and new learning builds on previous life experience. Generally, when we're teaching adults, we need to relate the information to what is already known. The information is presented at the individual person's level, and you need to establish how it's relevant to them. So why do you need to know about teaching adults? Well, in this instance, you're going to be teaching first year students. You actually need to know how to go about that. Focus on the immediacy of use. And again, it is going to be immediately used for you because you're going to be teaching in a few weeks and you need to be able to see how you're going to do that. Consider emotional, financial and other support systems. Allow self-pacing and self-direction as you can, and encourage the learner to be hands-on. Okay, in your reading there'll be more about adult learning, and you'll probably touch on that in your tutorials. There are other things to consider with adults. When we're aging, there are physical things that occur that can impede learning our effectiveness. So there are visual deficits to consider. The pupil size is reduced, colour sensitivity becomes reduced, and glare recovery reduces. There's implications here we'll talk about in the next slide. Auditory wise, it becomes less, the high pitch recognition becomes less sensitive, so that finding variations in voices and sounds can be a little more difficult. Psychomotor wise, there's a reduction in dexterity and slower reaction times, and a lowering of ability to use short-term memory. So I'm going to introduce yet another term to you, and that's gerogogy, which is a fairly recent term, and that means teaching older adults. Well, it's the teaching of older adults. So there are certain things we need to consider if our learners are older, and we know that a lot of our patients are aging. So we need to think about these sorts of things. When we're using print materials, it's important to use a large font size that can be easily read. You know that some of the books that older people read are actually large font books so that they can actually discriminate the words clearly. Reduce the light glare. That will help them to actually be able to use the visual aids that you're giving them. If you're going to use colours in your audio visual aids, make them strong. Don't use pastels. Ideally, if you're using visual aids, keep it black and white where you can. Those colours can be very easily discriminated. Speak clearly. Reduce environmental distractions because it becomes hard to shut out some outside noises as your sound changes. Allow the person time to self-pace. It might be slower than it might be for somebody younger. Minimise directions and reinforce oral instructions with written materials. What you tell a person who has an impaired short-term memory may be forgotten very quickly or not even recallable, whereas they may be able to recall what happened very clearly 20 years ago. So if you can reinforce your oral instructions with written instructions, that will help them to be able to remember the information you've taught them and not require them to have to go back and do it again. Present learning in manageable chunks. Other factors that influence the learner and learning. If the person's unwell or in pain, which a lot of our teaching is done with patients who are exactly in those situations, then learning's not going to be effective because those things, the illness and the pain, are probably going to be capturing their attention rather than your teaching. If they're anxious, the same thing. Gender, there is certain psychological work around the fact that different genders learn different things different ways. Culture may play a part, especially if the person has been in a culture that's has a very different educational approach to what you're trying to use. There may be physical impairment, and you might be able to think of some others. So there's lots that can influence teaching and learning. We're now going to look briefly at learning styles because we all have learning styles that we prefer. Learning styles are the ways in which and conditions under which learners most efficiently and most effectively perceive, process, store and recall what they are attempting to learn. Preferred approaches to different learning tasks, the way you learn. It takes into account your cognitive, your affective, psychological factors that affect how learners perceive, interact with and respond to the learning environment. Some characteristics of learning are biological in origin and some develop socially, especially through our schooling systems. It's important to remember that there is no learning style that is better. So some people are very auditory learners. They like to hear. Some people are visual. They like to see it. And others like to do it. So they're very hands-on learners. What tends to happen is we have a bit of both, but we have preferences for one or the other, which you may not be able to identify about yourself at the moment. So people have different approaches to learning. So if we're teaching a learner, we need to accommodate the fact that they might not learn best the way we learn best. And so how can we present information in different ways that addresses the needs of people with different learning styles? How can we present the same information and the same type of learning in different ways to ensure that everybody has effective learning? And you can imagine in a classroom setting where there's lots of people, there's lots of different learning styles. So understanding this will allow the nurse to tailor the education specifically to the learner. So I'm going to throw out there, how do you learn best? The next activity is also a Moodle activity, and this one is a very short one, but there are many more on the internet. If you're really interested in analysing your own learning style, you can do it in quite detailed ways. The tool that I've put on Moodle is a very short one that gives you a sense of how you might prefer to learn, remembering that this can also be influenced by the actual learning environment and the experience so that it changes. It's not locked in concrete, it can change. So we're going to finish this lecture now and you're going to move on to do that part of it. You'll see there's some activities and some readings here that relate to this part of the lecture, and then we'll move on to lectures, the third part of this second week of lectures, which is around planning for learning and teaching.